This video is made to introduce our research to develop a measurement system for the verification of the particle therapy. Compared to the conventional radiotherapy, the particle therapy using proton or carbon beam has many advantages. In order to concentrate the radiation dose into a treatment site, the X-ray beam should be radiated in several directions because the X-ray beam is very penetrative. Using the particle beam, however, it is easier to produce a concentrate dose because particle beam has finite beam range in medium and it delivers almost all of its energy at the end of the beam range due to the break peak. Let's take a look at the picture on your right for a comparison of X-ray and proton beam. If we suppose to treat the site marked as a blue circle using the conventional radiotherapy technique based on X-rays, the radiation dose is delivered to not only the tumor site, but also other normal organs and radiosensitive organs such as heart, as you can see in the figure. However, if we use a particle beam, we can deliver highly conformal dose to the treatment volume, and there is negligible dose delivered into normal or radiosensitive tissue. Because of these advantages, the interest in the particle therapy has been rapidly increased. After the introduction of medical dedicated accelerator in 1990s, the number of particle therapy centers and patients treated by particle therapy has been dramatically increased. However, if the particle beam range in a patient is not verified during the treatment, the advantages of the particle therapy can cause some problems. As you can see, if the unexpected density variation occurs in the patient in the particle therapy, the prescribed dose is not delivered to the treatment volume, or high dose can be delivered to healthy tissue or organs which affect the patient's safety. In particle therapy, the uncertainties of the beam range can be occurred due to many reasons, such as dose calculation error, intrafraction organ motion, interfraction anatomical change, patient setup errors, and others. Due to the uncertainties in the particle beam range, the treatment margin is usually employed in particle therapy. Because this margin delivers a necessary dose to normal tissues, the advantages of particle therapy cannot be maximized. So, in order to enhance the patient safety and maximize the advantages of particle therapy, a technique for real-time verification of the beam range in the patient should be developed. For the real-time verification of the beam range, the most promising method is prompt gamma imaging. The prompt gamma imaging is based on the distribution of prompt gamma rays which are generated by nuclear reaction between particle beam and patient. Using the correlation of prompt gamma and dose distribution, the beam range can be measured. After the first proposal of the prompt gamma imaging in 2003, we proved this method in 2006 for the first time, developing the prompt gamma measurement system. The measurement system, however, was for a proof of principle, so it had many limitations on clinical application. For clinical application, we first developed an array-type prompt gamma measurement system. We designed the measurement system based on Monte Carlo simulation using MCNP and JUNT4 code. Because we can simulate the behavior of radiation by Monte Carlo simulation, we can accurately estimate the performance of the design system before actually constructing the system. We performed Monte Carlo simulation for performance estimation. With the Monte Carlo simulation, we confirmed that the beam range could be determined by the design system. Based on this result, we have constructed a real measurement system. Before we develop a full array-type system, first we developed a single-channel test system with a single detector. Based on the development of the single-channel measurement system, we developed the array-type prompt gamma measurement system. For the performance evaluation of the developed system, experiments with therapeutic proton beams at National Cancer Center in Korea were carried out, and it was confirmed that the beam range can be determined with our system. Based on this result, we have developed a multi-slit prompt gamma measurement system. This system consists of a 72-channel collimation system using Shiftis-type tungsten collimator, a multi-channel signal processing system using commercial preamplifiers and amplifier chips, and an FPGA-based fast data acquisition system. We tested the performance of the developed system using therapeutic proton beam, and we found that the beam range can be determined within about 1 mm deviation. For the final stage of this research, we are planning to develop a measurement system based on circular arrangement for head and neck cancer treatment. This system can measure the beam range in a very short time based on the high imaging efficiency because it has a lot of detectors. To estimate the performance of the suggested system, we performed Monte Carlo simulation. By simulation study, it was confirmed that the measurement system can determine the beam range with very high detection efficiency. To monitor the particle therapy, we are also developing a 2D measurement system. The goal of this study is to measure not only the beam range, but also the 2D dose distribution in the patient. By Monte Carlo simulation study, we determined the design of the system and we constructed a 2D measurement system. The 2D measurement system consists of a parallel multi-hole collimator, a 2D scintillator array, a multi-anode photomultiplier, signal processing, and data acquisition system. We performed the experiment with a proton beam and confirmed that the developed system can determine the 2D dose distribution and particle beam range. In addition to the measurement system based on collimators, we suggest a new imaging method called gamma electron vertex imaging, GEVI, to determine the proton beam range. To determine the generation position of prompt gammas in GEVI, the gammas were converted to electron by Compton scattering in the electron converter, and then the converted electrons were attracted using two hodoscopes. Using the trajectories of electrons, the generation positions of the prompt gammas were determined with the line back projection algorithm. To test the feasibility of the new imaging method, first we performed some Monte Carlo simulation for therapeutic proton beams, and our simulation results show that the gamma electron vertex imaging can be used to image the proton beam dose distribution or to measure the proton beam range in the patient in proton therapy. For carbon beam, either. Based on the simulation study, we have constructed a proof-of-principle gamma electron vertex imaging system. To track the trajectories of the converted electrons, we use two DSSD as hodoscope detectors. To determine the electron energy, we used plastic scintillation detector. To process the signals from DSSD detectors, we have developed a low-noise signal processing system. First, this is charge-sensitive preamplifier. This is a key component for development of low-noise system. It converts a charge signal generated by a detector to a voltage signal. As the performance test, it shows almost same performance with a commercial product. Next, we developed a shaping amplifier to amplify and shape the signal to Gaussian shape. Considering the characteristics of detectors, we can develop various kinds of shaping amplifiers. Finally, this is multiplexing system developed by our lab for reducing the data acquisition channel. Using this system, we can reduce 16 channels to 2 channels. This is another detector in the GEVI system. This detector is used to determine the electron energy. This picture shows the plastic scintillation detector developed together with Sionix in Netherlands. We developed a DAQ and image reconstruction system. Using the digitizer, we converted detector signals to digital signals. With the data analysis program, we determined the effective event in energy and time window and reconstructed the 2D image using the line back projection algorithm. The performance of the proof-of-principle GEVI system was evaluated using therapeutic proton beam, and it was confirmed that the beam range can be monitored accurately. However, in order to apply the GEVI system into clinical use, larger field of view is necessary. For this reason, a prototype of GEVI system was developed and shown in this slide. Total 4 DSSD were used, and larger electron converter and plastic scintillation detector were also used to cover the detection area. Also, we developed an FPGA-based phase data acquisition system to obtain the detector signals with high speed and high efficiency. Again, the performance of the prototype GEVI system was estimated using therapeutic proton beam. And as you can see in this slide, the beam ranges with wide energy range could be accurately determined. Thank you.